Today, we're going to discuss two kinds of suffering, neonatal abstinence syndrome and maternal opioid use disorder, and the higher incidence occurring in rural areas. Everyone in healthcare is currently being affected by the opioid crisis, and our neonatal intensive care units are no different. The CDC, every 15 minutes, there is a new case of neonatal abstinence syndrome reported. Neonatal abstinence syndrome is a condition in which an infant is exposed to a damaging drug ranging from prescription medications to off-the-street drugs and is born in drug withdrawal. These infants are immediately transferred to the neonatal intensive care unit for further evaluation. Their bodies are scored by different symptoms presented, and a high score requires medication management, often with morphine or methadone. The increase in neonatal abstinence syndrome over the past 10 years has doubled. The outlier here is when healthcare providers were making attempts to identify the problem, they found incidence rates higher than double in rural areas. Many studies were in place to assess why rural areas would have a higher incidence for neonatal abstinence syndrome and maternal opioid use disorder, and what they found was not merely a group of drugged-up mothers. Now, to treat, we must prevent. The neonatal abstinence syndrome infant is born to the addicted mother. Maternal opioid use disorder is known as a maternal substance abuse during pregnancy. Mothers can take anything from pain medication to antidepressants to anti-anxiety meds that can cause withdrawal. The incidence is currently on the rise. The infant's neonatal intensive care unit stay is often navigated by the duration of opioid use, the frequency of medication administration, and the strength of dose. As we noticed before, neonatal abstinence syndrome rates in America are trending with the current opioid crisis. The two go hand in hand. The barriers to proper health care for pregnant women begin with poor family planning in rural areas. Limitations on healthcare providers available in smaller towns means a lack of contraceptive education and furthermore limited prenatal care. With limitations on prenatal care, there is a lack of change for the addicted mother, as forming a plan of care for her addiction during pregnancy would be addressed. Other limitations found were longer trips for substance abuse treatment centers, setting up the rural mother for failure. If she were able to travel for the initial visit, she may not be capable for follow-ups. Another focus of the studies for rural mothers addicted to opioids was that often smaller rural hospitals do not have NICUs. They did not have well-baby areas that were equipped to take care of a withdrawing infant. Due to a lack of higher level of care, infants were being transferred to urban cities in which the mother may not have the transportation to get to. If transportation were an option, not all urban hospitals had the means to offer free lodging for the mothers of the neonatal intensive care unit infants. The withdrawing infant can benefit from a mother's touch, called skin to skin, or being held by the mother. An addicted mother may not be able to handle the guilt of witnessing her withdrawing infant, and it may cause a setback. However, the addicted mother's resources are back in her rural hometown. Through proper screening tools, we can identify our female patients at risk for substance abuse. We can identify these women and place long-term contraceptives in play to prevent this situation from occurring. Through proper prescription writing for the pregnant mother, we can suggest alternatives to opioids, taper her dose down, or even set her up with a substance abuse treatment center. With more rural area healthcare resources available, such as substance abuse treatment centers, community centers with programs for opioid addiction, breastfeeding classes, parenting classes, we can help educate our addicted mothers. If rural healthcare resources were more available, we can help our pregnant and addicted mothers understand that they are not alone. Counseling could be more available to these mothers and would give them a chance to stand up against their addiction. Thank you for watching my video.